Hi guys, it's Christina Harold here, still vlogging from Vegas, and today I want to talk to you about a patient named Alice. Alice did not start off as my patient. She initially went to her primary care telling him that she had blurry vision and she also had diabetes. So her primary care rightfully sent her to get checked out, but he sent her to a retina specialist who specializes in diabetes. So when the retina specialist took a look at her, he dilated her eyes, saw the skin in the back of the eye had no bleeding, and sent her home. Well, she still had blurry vision and her problem did not get resolved. And this is why I want to help you learn the difference between all of the eye care professionals and who you should see and when. So I'm going to start off with talking about opticians. Opticians are eye care specialists who fit glasses. They specialize in making sure that the glasses fit well on the face. And before I started optometry school, I didn't really know much about what opticians did. I thought that they really just helped you pick out what color your glasses were, but opticians are so much more than that. Lens designs, different materials. I can only speak to the laws of Massachusetts because that's where I practice, but opticians either go through a 2-year program in college to get an associate's degree in opticianry, or they need to have equivalent work experience, and then they take a major test to get licensed. Working with an optician is so important because if you have the best eye exam in the entire world, even if your prescription is dead on, if your measurements are wrong type of lens material, or if your glasses are just a little bit crooked, I promise you, you will not be seeing as well as you could be. And depending on what your prescription is, it could throw you off 100% completely. Missing out on that professional advice from a licensed optician is just one of the disadvantages of buying glasses online, and we will talk more about that in a future video. Now, the thing that comes to everyone's mind probably the most when we talk about eye care professionals is ophthalmologists. Ophthalmologists are medical doctors. They went to medical school and they studied for 4 years of graduate school plus residency plus surgical training and fellowship, and they really know their stuff. But they might not always be the best person to see depending on what your problem is. So ophthalmologists don't typically prescribe glasses and contacts. Some of them do. It's usually the refraction, which is the pick which is better, 1 or 2. That is usually done by a technician, not by the ophthalmologist. Ophthalmologists specialize in certain areas. They might specialize in retina, which is the skin in the back of the eye. They might specialize in cornea, which is the skin on the front of the eye, or anywhere in between. They have neuro-ophthalmologists, glaucoma specialists, so many different types of specialists. And they most likely do surgery, whether it's cataract surgery, glaucoma surgery, and they prefer to spend their time really focusing in on what they studied. They want to do surgery. So now we get to talk about what I am. I'm an optometrist, so I'm not an MD. I did not go to medical school. I went to optometry school. So I studied for 4 years of graduate school. I am a doctor. I specialize in glasses, contact lenses, eye diseases, conjunctivitis. On a pretty much daily basis, I'm taking metal or out of somebody's eye. You can pretty much think of your optometrist as your primary care eye doctor for your eyes. We have the most extensive relationship with you, are the ones who spend the most time with you, and we know the entire picture, so we look at every single part of the eye. So our patient Alice that we were talking about earlier, she saw an ophthalmologist who checked her retina but did not give her glasses or contacts, didn't check the cornea, didn't look at anything else besides the one particular part of the eye that specialist specializes in, because that's what he does. So typically patients come in for a problem, say it's blurry vision, and there could be so many things that are causing that blurry vision. It could be needing glasses, it could be having a cataract, it could be having a bleed from diabetes, but just because you're diabetic doesn't necessarily mean that you're having diabetic complications, because you can still have other things go wrong. I hope from my talk you get to know the differences between some of the eye professionals. People ask me all the time if I want to become an ophthalmologist, and no, I don't want to become an ophthalmologist. Optometry and ophthalmology work hand in hand together, but they are completely different professions. As far as who you should see for your eye exam, typically I would recommend seeing an optometrist first, because we're the ones who look at the eye completely and we can tell you what's going on with it. For example, if you had a toothache, you'd go to a dentist, right? You wouldn't go to a maxillofacial surgeon. You would be evaluated by the dentist. They would say, oh, it's a cavity and I can fix that. Or they would tell you it's something more serious and then they would send you to the surgeon. So that's why your yearly exams, your primary care, eye care, is usually best done in the hands of an optometrist. It's perfectly fine to see both an optometrist and an ophthalmologist, and we work hand in hand with ophthalmologists all the time. Some disadvantages, though, of being seen with only ophthalmology and not getting a primary care exam by your optometrist are they could be missing other parts of what is going on. They have very, very long wait times usually because they're a specialist, so you expect to go to their office. They see a ton of patients, so you're most likely going to have a very long wait time with a very short eye exam. And if that's something that you're not comfortable with, then you should consider seeing an optometrist, and then the optometrist will send you to a specialist if you need it. So I know I drilled these points home a lot, but this is a question almost everyone asks me, and I really want to make sure I helped you understand the difference between an optician, an ophthalmologist, and an optometrist, who you should see and when, and how we can best help you with your particular vision needs.